Today, we dive into the mysterious phenomenon of growing pains in children, a very commonly misunderstood topic. Despite the famous name, the actual physical process of bones lengthening does not cause any pain for your child at all. The medical and scientific communities still do not have a definitive answer regarding the exact specific cause of this nighttime discomfort. To understand what happens, we must look closely at the human anatomy, specifically focusing on the muscular structures of the legs. Let us first examine the anterior thigh area, where many children frequently report experiencing a deep, frustrating ache during the night. Within this upper region, the quadriceps muscle group plays a massive role in daily movement and is often the primary suspect. Right alongside the quadriceps lies the sartorius muscle, the longest muscle in the human body, which also experiences significant daily stress. Moving further down the leg, the calf region and the back of the knee are other extremely common sites for discomfort. Here, we find the gastrocnemius muscle, the large bulky muscle at the back of the lower leg responsible for explosive movements. Just beneath that lies the soleus muscle, working tirelessly to maintain standing posture and balance throughout a long, active childhood day. Children typically describe this specific pain as a dull, throbbing ache, rather than a sharp or sudden stabbing sensation in joints. Interestingly, these frustrating aches almost exclusively appear late in the evening or during the night, often disrupting a peaceful sleep cycle. Another fascinating characteristic is that the discomfort usually affects both legs simultaneously, rather than being isolated to just one single side. Since bone growth itself is completely painless, medical researchers have developed several compelling theories to explain why these growing pains occur. The first major hypothesis explores psychological factors, suggesting a strong connection between the developing nervous system and heightened emotional sensory perception. Some experts believe that daytime emotional stress or anxiety might manifest physically as muscle aches when the child finally rests at night. The second leading theory focuses entirely on mechanical and anatomical issues that might place unnecessary strain on the lower extremities daily. For instance, conditions like flat feet can severely alter the natural walking gait of children, creating abnormal stress on leg muscles. Minor abnormalities in the knee or ankle joints can force the surrounding muscles to overcompensate, leading to severe fatigue and aching. Perhaps the most widely accepted explanation among pediatricians today is the simple concept of muscle overuse during highly active childhood years. Children between the ages of 3 and 12 are incredibly energetic, constantly pushing their developing bodies to their absolute physical limits. All this intense running and jumping causes microscopic tears in the muscle fibers, a normal process that requires significant recovery time. When these highly active children finally lie down to sleep, their tired muscles begin a rapid healing process that triggers discomfort. The fourth significant theory points toward potential nutritional deficiencies that might negatively impact healthy muscle function and normal bone density development. Specifically, a lack of vitamin D has been heavily linked to increased muscle soreness and general body aches in growing children. Other crucial minerals like calcium and magnesium are also absolutely vital for proper muscle contraction and relaxation throughout the long night. Because there is no specific medical test for growing pains, doctors usually diagnose this condition by carefully ruling out other diseases. However, parents must remain vigilant and watch for specific warning signs that indicate a much more serious underlying medical issue exists. If the pain continues into the morning or occurs during normal daytime activities, it is likely not a standard growing pain. Additionally, any visible swelling, severe redness, or unusual warmth around the joints should be immediately evaluated by a qualified healthcare professional. Unexplained fevers, persistent limping, or a sudden loss of appetite alongside leg pain are critical symptoms that demand urgent medical investigation. For typical nighttime aches, parents can employ several effective home remedies to provide immediate comfort and help their children sleep peacefully. Gently massaging the affected calves and thighs can significantly improve local blood circulation and effectively relieve accumulated tension in tired muscles. Applying a warm heating pad or a hot water bottle to the sore areas provides deep, soothing relief for aching tissues. Encouraging light stretching exercises before bedtime can also help maintain muscle flexibility and prevent those sudden, painful nighttime cramps from occurring. Proper hydration is another incredibly simple yet highly effective way to keep muscles functioning optimally and prevent severe cramping during sleep. Investing in excellent and supportive footwear can dramatically reduce the daily mechanical stress placed on the developing lower body of children. In particularly severe cases, pediatricians might recommend safe over-the-counter pain medications like ibuprofen to help the child sleep well. Perhaps the most important treatment is simple reassurance, letting your children know that this pain is entirely normal and completely temporary. Emotional support significantly reduces the anxiety associated with nighttime waking, allowing the young nervous system to calm down and rest properly. The wonderful news is that almost all children completely outgrow these frustrating episodes by the time they reach their early teenage years. It is simply a challenging but entirely natural phase of early human development, a small hurdle on the path to adulthood. Whether caused by muscle overuse, flat feet, or minor nutritional gaps, understanding these factors helps us better support our growing children. Always consult your trusted pediatrician if you ever feel unsure about these symptoms or if the pain seems unusually severe today. Thank you for watching. We hope this explanation brings you peace of mind. Subscribe for more fascinating medical insights.